systemic conditions, we need to do the blood investigations. So blood investigation can help to identify any infection, any inflammatory condition, or a neoplastic condition, or a metabolic causes, which we need to differentiate while we are diagnosing or investigating or evaluating a patient of low back pain. And it is very important to know that in which cases you are going to ask for the blood tests. These are some red flags where we immediately have to start further investigations. For example, the patient suspected cancer. In simple words, unexpected weight loss is basically suspected cancer or suspected inflammation in both the cases. So we need to initiate the blood test first. Associated with the infective signs, for example, fever, night pain, and the patient where the patient is having severe or progressive neurological deficits, we need to ask for the investigations and blood test in aged patient and in very young patient. In both the cases, if the patient is more than 50 or less than 20, in both the cases, we need to start or do investigations early. If there is history of malignancy or any cause of immunosuppression or IV drug use, in those cases also, there are possibilities of early infection. So we have to start the investigations early. Rest of the other cases, we can wait, we can give the NSAIDs and other drugs, and after, if it is not responding, then we can go for the blood test. Now, the most common test what we ask for is for the inflammation, basically to rule out inflammation. For young patient, you are getting facet arthropathy or FI arthropathy, at least signs and symptoms of the facet or FI arthropathy on evaluation. You should not miss ask to these two investigations. That means ESR and CRP. Why? It is elevated in infections, malignancies, and inflammatory disorders. Remember, ESR is a very non-specific marker, can be elevated in various conditions, but you should not miss. At least it should be, even if it is elevated, it should be in a lower range, not in a very high range, like more than 80 or more than 100. It helps to monitor the chronic conditions like ankylosing spondylitis or rheumatoid arthritis. And another very important thing is that while asking for these investigations, you also test clinically that whether you are suspecting other points or not. For example, when you are suspecting a case of spondyloarthropathy, ask whether there is history of uveitis. Is it there or not? So, in back of your mind, things should go in this fashion that you have to find out these conditions. Another important thing what commonly happens for those who are not worked as a general physician early and now starting as a pain physician is that in those cases we forget sometimes to ask whether you have a cough or cold, because these are the very common conditions that can actually increase these inflammatory markers. Even urinary tract for females, urinary tract infection, which is quite common, ask for the history of these disorders as well. This is very important when you are seeing patients in your OPD. Now coming to the C-reactive protein, it is usually more sensitive than ESR in acute inflammation, but it is also very useful in detecting acute infections like discitis or osteomyelitis. Definitely, other imaging investigations will help, but these investigations give you the early clue to search for further for the specific inflammatory markers or specific infective markers. Coming to complete blood count. Usually they are given together like CBC, ESR, CAP. So what is the importance of complete blood count? First of all, elevated levels of white blood cell might suggest infection. For example, it could be a bacterial spinal abscess. Hemoglobin low level can be suggestive of a chronic disorder. For example, that could be a malignancy or some other chronic disease. Platelet count can indicate inflammation or malignancy. So, thrombocytosis could be the possible cause. So, that is why complete blood count investigation is also very important. Now, coming to the bone metabolism markers like calcium and alkaline phosphatase. Hypercalcemia may point towards the malignancy, for example, multiple myeloma or hyperparathyroidism, whereas the alkaline phosphatase elevation could be possible in the bone disorders like Paget's disease or bone metastasis. And we have to take care of this part. Now, if you are getting and suspecting in MRI, there could be possibility of a multiple myeloma-like picture. Remember, in some patient, it becomes a little bit confusing because it could be possibility of an inflammatory arthritis or could be multiple myeloma giving similar kinds of picture. In those cases, ask for the monoclonal proteins. For example, we ask for the serum protein electrophoresis for presence of the protein or monoclonal antibody, as well as Debjyoti protein may also be elevated in those conditions. HLA-B27, that is the genetic testing for ankylosing spondylitis. Remember, HLA-B27 is not only positive for ankylosing spondylitis, but it also could be positive for other members of the spondyloarthropathy. For example, undifferentiated arthritis, psoriatic arthritis, Ritter's disease, arthritis associated with diabetes. In all those members, there could be possible increase in the positivity of the HLA-B27. This HLA-B27 is not diagnostic. For example, if the patient is having ankylosing spondylitis, it has been found to be associated with the 80% cases. 20% patients might have a HLA-B27 negative spondyloarthropathy, and it has been found that there are some other genes like anti-carbomoylated gene, they are also responsible. The positivity percentage is further low to do a regular clinical testing. Rheumatoid factors and anti-CCP. Though in rheumatoid arthritis, back pain is not a very common symptom. It is more commonly a symmetric peripheral arthritis. But in some cases of rheumatoid arthritis, you might find elevated level of the rheumatoid factor and anti-CCP. And anti-CCP is more specific to rheumatoid arthritis, which can cause secondary back pain in some patients due to spinal involvement. Though the spinal involvement is much more common in spondyloarthropathy than rheumatoid arthritis. So in conclusion, it is a rough guideline. These are the common investigations we ask for in the patients of the back pain. But these back investigations are crucial, especially identifying the non-mechanical causes of back pain, and use investigations as for the clinical findings as well as imaging. So it should be used simultaneously with the imaging techniques, and early diagnosis of the systemic causes can lead to better patient outcome. So it was a very small presentation, but remember, these are the things that we commonly encounter in the clinics, and we have to check for or investigate patients with these disorders, and then according to the disease or according to your finding, you can go further forward.